Oh. Hi there, Miss Smith.
Hi.
I'm Loretta Parker. I'm a PA student. I'll be taking care of you today.
Okay.
All right. Can you tell me what brings you in today?
I have this sort of like bumpy like growth on my vagina, and it's kind of concerning me.
All righty. Okay. All righty. When did you first notice this?
Probably about 1 month ago.
Okay. All righty. Can you tell me a little more about that?
I first noticed it. I was just using the bathroom, and whenever I got finished and started to wipe, I sort of felt it. So I looked at it, and it just is very bumpy and like protrudes a lot.
Okay. Alrighty. Can you tell me about where it's located?
It's like on the left side, like sort of by the opening.
Opening of the vagina?
Uh-huh.
Okay. Alrighty. Now, have you noticed it like staying this whole time, or does it come and go?
Yeah, it just stays.
Okay, stays constant. Alrighty. All right, and then you said it felt bumpy and protrudes. Any other characteristic traits this has that you've noticed?
No, not really. Sometimes it, like if I wipe it too hard or something, it'll bleed just like a tad bit, but it's like just a little pinpoint. It's not really like bad or anything.
Have you noticed any changes in size?
Yeah, it's kind of growing.
Okay.
It was just like a very small, like the end of the cap of your pin sort of size, and now it's like this big, like, I don't know, big lumpy thing.
Okay. I'm sorry to hear that. Have you noticed any other symptoms like itching or pain or burning?
Not really. I mean, it'll itch a little bit sometimes, but it's not like anything to write home about.
Okay. Is that itching? You said it's sometimes. Do you know what you're doing while it, when it starts to itch, anything that you're doing that could maybe bring that about?
Right, just like right after it'll do that, a little bit of bleeding. Sometimes it'll itch.
Alrighty. Okay, so you said it's getting bigger over time. Is it growing like pretty rapidly or just maybe slowly getting bigger?
Just a little bit, just slowly.
Okay, so you didn't have any pain with it?
No.
Okay. Have you ever had anything like this before?
No.
Okay. Alrighty. And then have you noticed that anything like makes it better at all?
No.
Anything that
Nothing.
you may be doing with it that maybe might help with it? Okay.
No. I mean, the symptoms are so little that there's really not much to make it better, but nothing is making it smaller.
Okay. All right. I'm going to ask you a few questions just kind of about your overall health and well-being. Have you noticed any fever or chills?
No.
What about fatigue?
No.
What about malaise, just like an overall feeling of unwellness?
No.
Okay. All right. You said no fatigue. What about any just kind of generalized weakness?
No.
Okay. Any changes in appetite?
No.
What about weight changes?
Mm-mm.
Okie dokie. All right, I'm going to ask you a few questions just about about the breast area and your genital region. So have you noticed any pain in your pelvic area, like in the pelvis, the hips?
No.
No. All right. Have you gotten your period?
Yes.
Okay. What was your age when you got your first period?
Probably around 12.
Okay. All right. When was your last menstrual period?
I have Mirena, so they're very few and far between. So my last one was probably about 2 months ago.
Okay. How long have you had your Mirena, just while we're on the subject?
About 2.5 years.
Okay. No complications from that you've noticed?
I get hemorrhagic cysts from them, or from it, but that's it.
How many episodes of the hemorrhagic cysts have you had?
I've had 2.
Okay. All right. And have you gotten that seen about?
Yes.
Okay.
They just kind of go away on their own.
Okay, but you are, like, you've seen a provider for treatment and all of that for it? Okay.
Yes. Mm-hmm.
Alrighty. Have you noticed any, when you do have your periods, are they just like excessively heavy?
No.
No? Okay. All right. Have you had any spotting in between your cycles?
No.
Okay. What about just any like excessive, more than usual pain during your cycle?
No.
Okay. Alrighty. What about any hot flashes?
Nope.
Okay. Vaginal dryness?
No.
Okay. What about vaginal itching?
No. I mean,
Like aside
that
from
little spot.
Yeah.
Yeah, aside from that, no.
Okay. What about any masses other than that one lesion?
No.
Okay. What about vaginal discharge?
No.
Okay. Alrighty. Ask you a few questions about your breasts as well. Have you noticed any breast pain?
No.
Okay. What about breast tenderness?
No.
Any bleeding from your nipples?
No.
What about discharge from your nipples?
No.
Okay. Have you noticed any masses or lumps in your breast?
No. Okay. Mm-mm.
All right. Are your breasts asymmetric?
No.
Just kind of like maybe one's
Not
bigger than the other.
Yeah, no, not obviously.
Okay. Alrighty. Any itching in your breasts?
No.
Okay. What about changes in color or temperature?
No.
What about texture changes?
No.
Okay. Alrighty. So we're going to kind of move on just to kind of your past medical history. Do you yourself have a history of hypertension?
No.
Okay. What about high cholesterol?
No.
Diabetes?
Mm-mm.
Stroke?
No.
Heart disease?
No.
Heart attacks?
Mm-mm.
Cancer?
No.
Okay. And you said, I'm sorry, no strokes, no history of strokes? Okay.
No.
Alrighty. Have you ever been hospitalized?
Once I had a car wreck at 17 and I was hospitalized for 5 days.
Oh my goodness. Were there any complications from that?
No. I mean, I have 4 plates and 18 screws in my jaw, and I had to have my elbow put back into place.
Oh my goodness. Which elbow?
My right elbow.
Okay. Have you ever been hospitalized for anything else?
No.
Okay. What about, have you ever had any like inpatient or outpatient surgeries?
I had my wisdom teeth removed.
Okay. When was that?
Probably 2014.
Okay. No complications from that?
No.
Okay. And then no complications from the procedures from your car accident?
No.
All right. All right. Now, other than the Mirena, are you on any other medications?
No.
No. Okay. You haven't been taking anything for the lesion?
No.
Into it. Okay.
I'll take a naproxen. It's 220 milligrams for the pain from the hemorrhagic cysts.
200 milligrams, you said?
220.
20. Okay. How often do you take those?
When I have the cysts, which I've had 2 in the past, and they last for about a month each,
Okay.
I'll take it pretty much every day during that time period. But other than that, I don't take it.
Okay. How far apart were these occurrences with your cysts?
I had one, and then probably a month later, I had another one. I've just recently gotten rid of that one.
Okay, so when did this start? When did the first one start?
The first one was probably about 3 months ago.
Okay.
I was seen, well, maybe a little bit before that, because I was actually seen in July for that.
Okay. And the second one?
Yeah, that's just been, I just got rid of it probably 2 weeks ago, and it was there for several weeks, probably 3 or 4 weeks.
And when do you think it started?
Probably 6 weeks ago, sometime in September.
Alrighty, and you just take one of those naproxens at a time?
I take 2.
2?
2 once a day. Yeah.
Alrighty, and are you allergic to anything like latex, medications, food?
No.
Do you have seasonal allergies?
No.
Okay. Alrighty. I'm going to ask you a few questions about your family history. Are both of your parents still living?
My dad died.
Okay. What age was he when he passed away?
Maybe 41.
Okay. Do you mind telling me the cause?
Scleroderma.
Okay. And how old is your mother?
She is 52, 51, 52.
Okay. Okay, and then do you have any biological siblings?
One sister.
One sister. How old is she?
25.
Alrighty, and do you have any children?
No.
Okay. So within regards to your mother and sister, and then what you can remember from your father's medical history, just let me know if any of these had occurred. Any history of hypertension?
No.
What about diabetes?
No.
High cholesterol?
No.
Okay, heart disease?
No.
Heart attack?
No.
Stroke?
No.
Or cancer?
No.
Okay. Okie dokie. So a little bit about your background, just maybe some social things that you may or may not have been exposed to. Do you currently use tobacco products?
No.
Smoking, vaping, dipping? Okay,
No.
have you use them?
No.
Okay. Did you grow up in a home where maybe secondhand smoke was possible, like both your parents smoked or anything, or one?
No. Mm-mm.
Alrighty. Do you drink alcohol?
About once a week.
Once a week? And then what are you drinking and how often?
I usually will drink like a beer, and it'll be about maybe 3 or 4 at a time.
3 or 4 beers once a week. Okay. Do you do any recreational drugs currently?
No.
Have you ever been a user of recreational drugs?
No.
Okay. Can you tell me about your everyday diet?
For breakfast, I'll either I'm usually not very hungry at breakfast. I'll have like a cup of coffee, maybe a granola bar, maybe some grits. For lunch, I'll normally have like tuna salad or something like that. And then for dinner, I'll cook like a meat and some kind of veggie or mac and cheese or something like that.
Okay. Okay, and then how often do you exercise each week?
3 to 4 times.
Alrighty, what does that exercise consist of?
I either run, I lift weights, or on Fridays I do Pilates.
Okay. What's like the timeline for how long you're doing this? How long are you running at a time? How long are you lifting weights at a time?
30 minutes to an hour.
Okay. And then are you currently employed anywhere?
I'm a student.
Okay. I know students tend to stay stressed. Do you find yourself with excessive stress going on?
Yes.
Yeah. What are some things that you're doing to kind of help cope with that?
I'll either exercise or I'll spend time with my friends.
Alrighty. Now, do you feel like you can financially afford health care? Like if we prescribed you medications today, you'd be able to afford them?
Yes.
And then what is your current living situation? Who are you living with?
I live with my fiance.
Okay. And do you feel safe at home?
Yes.
And are you sexually active?
Yes.
Okay. You currently just have one sexual partner?
Yes.
Alrighty. And are you using any form of birth control or anything aside from the Mirena?
No.
Alrighty. So we're going to go ahead and verbally perform the physical exam since we aren't doing it actually in person today. So we would normally start with just kind of with the genital area. We would inspect the external genitalia. We would palpate the external genitalia. We would perform our speculum exam where we check like the cervix and the vagina. We would perform the bimanual exam, which would also include like the cervix, just kind of feeling and seeing where, like feeling for where the uterus is lying in what position and so on. And then we would also perform our pap smear and our rectovaginal exam. We would then move on to the breast exam where we would inspect the breast, including the breast areola and nipple, would palpate the breast in all 4 quadrants in different areas, and then we would also palpate the axillary lymph nodes and the supraclavicular and infraclavicular lymph nodes. So based on the findings from today and just kind of the way you've described this lesion and everything, it seems like you more than likely probably have HPV. Did you get your Gardasil vaccine?
Yes.
Okay. What age were you when you got that?
Probably like 11.
Okay. And you got both doses?
Yeah.
Okay. And also while we're on vaccines, did you get your flu shot this year?
Not yet.
Okay. Okay, so you have had your Gardasil vaccine, but still just the way it's presenting, HPV is probably still the most likely. Could also be herpes, although that tends to be way more painful and have a little more like pustule vesicle ulcers and just way more aggravated. It could also, because it's painless, could very well be like a syphilitic canker or maybe, a completely different STI altogether, but that's kind of what I'm thinking right now.
Okay.
All righty. Thank you so much.
Thank you.